HESI Nursing Knowledge Test. Question 1. Before administering a live virus vaccine to a patient taking a glucocorticoid medication, what action should the nurse take? Continue screening and administer the vaccine if appropriate. Note the contraindication, but administer the vaccine regardless. Note the contraindication and clarify the order with the healthcare provider. Withhold the vaccine and inform the Department of Health. C. Note the contraindication and clarify the order with the healthcare provider. Correct answer. The correct action for the nurse to take when a patient on glucocorticoid medication is to note the contraindication and clarify the order with the healthcare provider. Glucocorticoids can suppress the immune response, potentially reducing the effectiveness of vaccines. Therefore, it is crucial to consult with the healthcare provider to assess the risks and benefits of administering a live virus vaccine in such circumstances. Administering a live virus vaccine to a patient taking glucocorticoids can increase the risk of developing a viral infection, making it essential to seek guidance from the healthcare provider before proceeding. Question 2. When a patient is taking glucocorticoids and digoxin, which electrolyte should the nurse prioritize monitoring? Calcium, magnesium, sodium, potassium. D. Potassium. Correct answer. In this scenario, the correct answer is D. Potassium. When a patient is taking glucocorticoids and digoxin, the nurse should prioritize monitoring potassium levels. Glucocorticoids can cause potassium depletion, leading to hypokalemia. Digoxin, on the other hand, can cause toxicity, especially in the presence of low potassium levels, which can potentiate its effects on the heart and increase the risk of serious cardiac arrhythmias. A. Calcium is not the most critical electrolyte to monitor in this case. While it is important for muscle and nerve function, it is not directly affected by the combination of glucocorticoids and digoxin. B. Magnesium is also important for muscle and nerve function, but it is not the priority electrolyte to monitor when a patient is taking glucocorticoids and digoxin. C. Sodium levels are typically not significantly impacted by glucocorticoids and digoxin in a way that would necessitate prioritizing monitoring compared to potassium in this specific scenario. Educationally, understanding the interactions between medications and electrolyte imbalances is crucial for pediatric nurses. This knowledge helps in providing safe and effective care to pediatric patients, especially those on multiple medications with potential interactions. Prioritizing monitoring based on these interactions can prevent complications and improve patient outcomes. Question 3. The healthcare provider is planning care for a patient receiving morphine sulfate via a patient-controlled analgesia pump. Which intervention may be required due to a potential adverse effect of this drug? Administering a cough suppressant, inserting a Foley catheter, administering an antidiarrheal, monitoring urinary output. B. Inserting a Foley catheter. Correct answer. Morphine can lead to urinary retention and urinary hesitancy. If a patient shows signs of bladder distension or inability to void, the healthcare provider should be notified and urinary catheterization may be necessary. Administering a cough suppressant or an antidiarrheal is not typically required to address adverse effects of morphine. Liver function tests, LFTs, are not directly related to the potential adverse effects of morphine on the urinary system. Question 4. Which medication is most likely to cause serious respiratory depression as a potential adverse reaction? Morphine, pentazocine, hydrocodone, nalmefene. A. Morphine. Correct answer. Morphine, as a strong opioid agonist, has the highest likelihood of causing serious respiratory depression due to its potent effects on the central nervous system. While pentazocine and hydrocodone can also cause respiratory depression, they are less likely to do so compared to morphine. Nalmefene, an opioid antagonist, is used to reverse respiratory depression caused by opioids rather than causing it. Question 5. The nurse is teaching a patient with cancer about a new prescription for a fentanyl patch, 25 micrograms per hour, for chronic back pain. Which statement is the most appropriate to include in the teaching plan? You will need to change this patch every day, regardless of your pain level. This type of pain medication is not as likely to cause breathing problems. With the first patch, it will take about 24 hours before you feel the full effects. Use your heating pad for the back pain. It will also improve the patch's effectiveness. C. With the first patch, it will take about 24 hours before you feel the full effects. Correct answer. In this scenario, option C is the most appropriate statement to include in the teaching plan as it provides crucial information about the fentanyl patch's onset of action. Understanding that it may take about 24 hours for the patient to feel the full effects of the patch is essential for managing pain effectively without becoming discouraged by immediate results. Option A is incorrect as fentanyl patches are typically worn for 72 hours before being changed, not daily. Changing the patch more frequently could lead to overdose. Option B is incorrect because fentanyl, being a potent opioid, does have the potential to cause respiratory depression, especially if used improperly or in high doses. It is crucial for patients to be aware of this risk. Option D is incorrect as using a heating pad with a fentanyl patch can increase the absorption rate of the medication, leading to potential overdose and adverse effects. It is important to educate patients to avoid heat sources with fentanyl patches. Educationally, this question emphasizes the importance of accurate patient education regarding pain management medications, including dosing, onset of action, potential side effects, and proper use to ensure safe and effective pain control in pediatric oncology patients. Question 6. A post-op patient has an epidural infusion of morphine. The nurse anticipated administering naloxone, Narcan, acetylcysteine, Mucomyst, methylprednisolone, solomedrol, protamine sulfate. A. Naloxone, Narcan. Correct answer. In this scenario, the correct medication that the nurse would anticipate administering is A. Naloxone, Narcan. Morphine sulfate is an opioid analgesic that can cause respiratory depression as a side effect. Naloxone is an opioid antagonist that can quickly reverse the effects of opioids like morphine, including respiratory depression. Administering naloxone can help restore the patient's respiratory rate back to normal. Option B, acetylcysteine, Mucomyst, is used as a mucolytic agent to help break down mucus in conditions like COPD and cystic fibrosis, not for reversing opioid-induced respiratory depression. Option C, methylprednisolone, solomedrol, is a corticosteroid used for its anti-inflammatory properties and would not be the appropriate intervention for opioid-induced respiratory depression. Option D, protamine sulfate, is used to reverse the effects of heparin, an anticoagulant, and is not indicated for opioid overdose. In an educational context, it is crucial for nurses to be able to identify signs of opioid overdose, such as respiratory depression, and know the appropriate interventions such as administering naloxone. Understanding pharmacological interventions for common postoperative complications is essential for providing safe and effective patient care in pediatric nursing. Question 7. A patient in the emergency department reports taking. The nurse immediately report to the physician. WBC of 3,200 units/L, RR of 26 breaths/ min temp of 38 degrees Celsius, BP of 70 fiftieths. D, BP of 70 fiftieths. Correct answer. The correct answer is D, BP of 70 fiftieths. When sildenafil, Viagra, is taken with nitroglycerin, it can cause severe hypotension that is unresponsive to treatment. The combination of these medications can lead to a dangerous drop in blood pressure. It is crucial to immediately report hypotension in this scenario. It is recommended to allow at least 24 hours to elapse between the last dose of sildenafil and nitroglycerin to prevent such adverse effects. The other vital signs and lab values may be abnormal, but do not have the immediate life-threatening implications that severe hypotension does in this context. Question 8. A patient taking sildenafil, Viagra, asks a nurse what action to take if priapism occurs. Which response should the nurse provide? take an additional half-strength dose of sildenafil. The condition usually resolves in 12 hours or less. Wait until the following day and notify the doctor. Seek emergency help because permanent damage can occur. D. Seek emergency help because permanent damage can occur. Correct answer. Patients experiencing priapism from sildenafil should seek immediate medical attention. Priapism is a serious condition where an erection lasts longer than 4 hours, and if left untreated, it can lead to irreversible damage to the penile tissue, potentially causing permanent erectile dysfunction. Therefore, prompt intervention is crucial to prevent long-term complications. Question 9. When educating a patient about sildenafil, Viagra, which adverse effect should be a priority for the patient to report to his prescriber? Flushing, diarrhea, hearing loss, dyspepsia. C. Hearing loss. Correct answer. The correct answer is C. Hearing loss. In rare cases, Viagra has been associated with sudden hearing loss, typically in one ear, which can be partial or complete. Any onset of hearing problems while using Viagra should be reported promptly to the prescriber. It is recommended to discontinue the medication if it is used for erectile dysfunction. Flushing, diarrhea, and dyspepsia are known adverse effects of Viagra, but are generally less serious compared to hearing loss. Question 10. After administering Gardasil, the HPV vaccine, to an 11-year-old girl, the healthcare provider informs the parent that routine screening with which diagnostic test is needed: beta HCG, chlamydia test, pap test, mammogram. C. PP test. Correct answer. Following the administration of Gardasil, the HPV vaccine, routine screening with a PP test is necessary. While Gardasil protects against certain types of HPV, it does not cover all strains that could lead to cervical cancer. Therefore, individuals who have received the vaccine should still undergo regular PP tests to screen for cervical abnormalities caused by other HPV strains. Question 11. Which statement by an 18-year-old woman vaccinated with Gardasil indicates that more teaching is necessary? This vaccination will cure the HPV infection I got when I was 16. I will still need to have a routine pap screen performed. Gardasil can prevent genital warts in males and females. This drug does not protect against all types of HPV. A. This vaccination will cure the HPV infection I got when I was 16. Correct answer. The correct answer is A because Gardasil does not cure existing HPV infections. Gardasil is a preventive vaccine and does not treat existing infections. Choice B is correct as regular pap screenings are still necessary even after vaccination. Choice C is also correct as Gardasil can prevent genital warts. Choice D is correct as Gardasil does not protect against all types of HPV. Therefore, option A is the statement that indicates the need for more teaching. Question 12. A child receives a vaccine for MMR. 6 hours after the nurse take. Give instructions on relieving symptoms with acetaminophen. Seek emergency help because these symptoms are signs of anaphylactic reaction. Tell the parent that a live vaccine will cause a mild case of measles. Obtain and fill out a vaccine adverse event report form. A. Give instructions on relieving symptoms with acetaminophen. Correct answer. The correct action for the nurse to take in this scenario is to give instructions on relieving symptoms with acetaminophen. Option A. This is the appropriate response because the symptoms described by the parent, local soreness, erythema, lethargy, and a low-grade fever, are common and expected side effects following a vaccine administration, particularly the MMR vaccine. These symptoms are typically mild and can be managed with supportive care, such as acetaminophen for fever and discomfort. Option B, seeking emergency help for signs of anaphylactic reaction, is incorrect in this case as the symptoms presented are not indicative of a severe allergic reaction. Option C is also incorrect as it provides inaccurate information about live vaccines causing a mild case of measles, which is not true for the MMR vaccine. Option D, Filling out a vaccine adverse event report form is not necessary at this point, as the symptoms are within the expected range for a vaccine reaction and do not warrant reporting as an adverse event. From an educational perspective, it's important for nurses to be able to differentiate between common, mild vaccine reactions and more serious adverse events. Understanding the expected side effects of vaccines and how to manage them is crucial in providing safe and effective care to pediatric patients. Nurses should also be able to educate parents about normal post-vaccination symptoms and when to seek further medical attention. Question 13. In an immunization clinic, which patient will the nurse identify as not eligible to receive routine immunizations? An 8-year-old experiencing diarrhea, a 2-year-old with a history of preterm birth, a 4-year-old with a fever and upper respiratory tract infection, a 6-year-old who has been recently exposed to a classmate with chickenpox. C. A 4-year-old with a fever and upper respiratory tract infection. Correct answer. The nurse should identify the 4-year-old with a fever and upper respiratory tract infection as not eligible to receive routine immunizations. It is contraindicated to administer vaccines in the presence of moderate to severe illness, whether with or without fever, to prevent potential complications or reduced vaccine efficacy. Question 14. Which statement should the nurse include in the teaching plan for a patient being started on levodopa/carbidopa Sinemet for newly diagnosed Parkinson's disease? Take medication on a full stomach. Change positions slowly. The drug may cause the urine to be very dilute. Carbidopa has many adverse effects. B. Change positions slowly. Correct answer. Postural hypotension is common early in treatment, so the patient should be instructed to change position slowly. Administration with meals should be avoided, if possible, because food delays the absorption of the levodopa component. If the patient is experiencing side effects of nausea and vomiting, administration with food may be considered. The levodopa component may darken urine. Carbidopa has no adverse effects of its own. Question 15. What is the goal of pharmacologic therapy in the treatment of Parkinson's disease? To increase the amount of acetylcholine at the presynaptic neurons. To reduce the amount of dopamine available in the substantia nigra. To balance cholinergic and dopaminergic activity in the brain. To block dopamine receptors in presynaptic and postsynaptic neurons. C. To balance cholinergic and dopaminergic activity in the brain. Correct answer. In the treatment of Parkinson's disease, the goal of pharmacologic therapy is to balance cholinergic and dopaminergic activity in the brain, which is why option C is correct. Dopamine is a neurotransmitter that is deficient in Parkinson's disease, leading to motor symptoms. By aiming to balance cholinergic, acetylcholine, and dopaminergic activity, medications can help alleviate symptoms and improve motor function in patients with Parkinson's disease. Option A, to increase the amount of acetylcholine at the presynaptic neurons, is incorrect because Parkinson's disease is primarily characterized by a lack of dopamine, not acetylcholine. Option B, to reduce the amount of dopamine available in the substantia nigra, is also incorrect as the goal is to increase dopamine levels to compensate for the deficiency. Option D, to block dopamine receptors in presynaptic and postsynaptic neurons, is not aligned with the treatment approach for Parkinson's disease, which focuses on enhancing dopamine activity rather than blocking it. Educationally, understanding the goals of pharmacologic therapy in Parkinson's disease is crucial for pediatric nurses caring for patients with this condition. By grasping the rationale behind the medications used, nurses can ensure safe administration, monitor for effectiveness, and educate patients and families on the purpose and expected outcomes of treatment. This knowledge enhances the quality of care provided to pediatric patients with Parkinson's disease and contributes to better patient outcomes. Question 16. The patient is receiving a heparin infusion for the treatment of pulmonary embolism. Which assessment finding is most likely related to an adverse effect of heparin? HR of 60 BPM, BP of 160/88, Discolored urine. Inspiratory wheezing. C. Discolored urine. Correct answer. The primary and most serious adverse effect of heparin is bleeding. However, discolored urine can indicate bleeding into the urinary tract, which is a potential adverse effect of heparin therapy. While changes in heart rate, HR, and blood pressure, BP, can occur due to various reasons, discolored urine specifically points towards a potential adverse effect related to heparin therapy. Question 17. The patient taking warfarin for prevention of deep vein thrombosis has an INR of 1.2. Which action by the nurse is most appropriate? Administer 4-push protamine sulfate. Continue with the current prescription. Prepare to administer vitamin K. Call healthcare provider to increase the dose. D. Call healthcare provider to increase the dose. Correct answer. In the context of pediatric nursing and the administration of warfarin, a low INR of 1.2 indicates that the patient's blood is not adequately anticoagulated, putting them at risk for clot formation. The most appropriate action by the nurse is to call the healthcare provider to increase the dose of warfarin. This is because the current dose is not achieving the desired therapeutic effect, and an adjustment is needed to reach the target INR range. Option A, administering 4-push protamine sulfate, is incorrect as protamine sulfate is used to reverse the effects of heparin, not warfarin. Continuing with the current prescription, Option B, would not address the subtherapeutic INR level. Option C, preparing to administer vitamin K, is not the first-line intervention for a low INR in a patient taking warfarin. It is typically reserved for cases of warfarin overdose or when there is excessive anticoagulation leading to bleeding. In a pediatric nursing context, it is crucial to understand the appropriate actions to take when managing anticoagulation therapy in children to ensure their safety and well-being. Monitoring and adjusting warfarin doses based on INR levels are essential components of pediatric nursing care to prevent complications such as thrombosis or bleeding events. Question 18. The nurse is reviewing the home medication list with the patient. The nurse recognizes that hydrochlorothiazide is used primarily for which condition? Hypertension, edema, diabetes insipidus. Protection against postmenopausal osteoporosis. A. Hypertension. Correct answer. Hydrochlorothiazide is primarily indicated for hypertension, HTN. Thiazides like hydrochlorothiazide are commonly the first-line treatment for hypertension. While hydrochlorothiazide can be used for edema, diabetes insipidus, and postmenopausal osteoporosis to some extent, its main use and efficacy lie in managing hypertension. Question 19. The nurse is teaching a patient who has a new prescription for spironolactone, aldactone. Which statement by the patient indicated that the teaching was effective? I will use salt substitutes to lower my sodium intake. I will increase my intake of foods that are high in potassium. I will call my doctor if I begin having menstrual irregularities. I will take this medication at bedtime each evening. C. I will call my doctor if I begin having menstrual irregularities. Correct answer. Spironolactone is a potassium-sparing, aldosterone-blocking diuretic. As such, it can cause endocrine effects such as gynecomastia, menstrual irregularities, impotence, hirsutism, and deepening of the voice. Patients taking spironolactone should avoid salt substitutes because they contain potassium. High potassium foods should be avoided with this drug. Ideally, all diuretics should be taken in the morning to prevent nocturia. Question 20. In the management of heart failure, which diuretic is preferred due to its demonstrated significant mortality reduction in patients with heart failure? Furosemide, Lasix, hydrochlorothiazide, hydrodiuryl, spironolactone, aldactone, mannitol, osmotrol. C. Spironolactone, aldactone. Correct answer. In the management of heart failure, the preferred diuretic due to its demonstrated significant mortality reduction in patients with heart failure is spironolactone, aldactone. Spironolactone is a potassium-sparing diuretic that not only helps in reducing fluid overload, but also exerts additional benefits through its aldosterone antagonistic effects. By blocking aldosterone receptors, spironolactone helps in reducing myocardial fibrosis and remodeling, leading to improved outcomes in heart failure patients. The other options listed are not preferred for significant mortality reduction in heart failure. A. Furosemide, Lasix, while furosemide is commonly used to manage fluid overload in heart failure. It does not offer the same mortality benefits as spironolactone. B. Hydrochlorothiazide. Hydrodiuryl hydrochlorothiazide is a thiazide diuretic that is not typically used for the management of heart failure. It is more commonly used for hypertension and edema due to other causes. D. Mannitol. Osmotril mannitol is an osmotic diuretic that is not commonly used in the management of heart failure. It is more often used for conditions such as cerebral edema or acute kidney injury. In pediatric nursing practice, understanding the rationale behind choosing specific medications for conditions like heart failure is crucial for providing safe and effective care to pediatric patients. It is essential to be aware of the pharmacological properties of diuretics and their impact on pediatric patients with heart failure to optimize treatment outcomes and minimize adverse effects. Question 21. The nurse plans to closely monitor for which clinical manifestation after administering furosemide, Lasix: decreased pulse, decreased temperature, decreased BP, decreased respiratory rate. C. Decreased BP. Correct answer. In pediatric nursing, understanding the effects of medications like furosemide, Lasix, is crucial. The correct answer is C. Decreased BP. Furosemide is a loop diuretic that works by increasing urine output, leading to fluid and electrolyte loss. This diuretic effect can result in a decrease in blood pressure due to reduced circulating volume. Option A, decreased pulse, is incorrect because furosemide does not directly affect heart rate. Option B, decreased temperature, is incorrect as furosemide does not typically impact body temperature. Option D, decreased respiratory rate, is also incorrect as furosemide does not have a direct effect on respiratory function. Educationally, it's important to understand the expected outcomes and side effects of medications used in pediatric patients to provide safe and effective care. Monitoring for changes in vital signs and clinical manifestations after administering medications like furosemide is essential to assess the drug's effectiveness and ensure patient safety. This question highlights the need for nurses to be vigilant in monitoring pediatric patients receiving diuretic therapy to prevent potential complications related to fluid and electrolyte imbalances. Question 22. What is the most appropriate nursing consideration for a patient who is prescribed verapamil and digoxin? Restrict intake of oral fluids and high-fiber foods. Take an apical pulse for 30 seconds before administration. Notify the healthcare provider of nausea, vomiting, and visual changes. Hold the medications if the heart rate is greater than 110 bpm. C. Notify the healthcare provider of nausea, vomiting, and visual changes. Correct answer. When a patient is prescribed verapamil and digoxin, it is crucial to monitor for signs of digoxin toxicity due to the potential interaction between these medications. Verapamil can elevate digoxin blood serum levels, increasing the risk of toxicity. Symptoms of digoxin toxicity include nausea, vomiting, and visual changes. Restricting intake of oral fluids and high-fiber foods is not a specific consideration related to this medication combination. Before administering digoxin, it is essential to take an apical pulse for a full minute, not just 30 seconds. Additionally, holding the medications if the heart rate exceeds 110 bpm is not a typical response to the combination of verapamil and digoxin, which can cause bradycardia rather than tachycardia. Question 23. The nurse provides discharge instructions to a patient prescribed verapamil SR 120 mg PO daily for HTN. Which statement by the patient indicates understanding of the medication? I will take the medication with grapefruit juice each morning. I should expect occasional loose stools from this medication. I'll need to reduce the amount of fiber in my diet. I must swallow the pill whole. D. I must swallow the pill whole. Correct answer, SR, indicates that the drug is sustained release. Therefore, the patient must swallow the pill intact, without chewing or crushing, which would result in a bolus effect. Grapefruit juice should be avoided because it can inhibit intestinal and hepatic metabolism of the drug, thereby raising the drug level. Constipation, not loose stools, is a common side effect. Increasing fluids and dietary fiber can help prevent this adverse effect. Question 24. For which patient diagnosis would a prescription for nifedipine be least appropriate? Angina pectoris, essential HTN, atrial fibrillation, vasospastic angina. C. Atrial fibrillation. Correct answer. Nifedipine primarily acts as a calcium channel blocker. It lacks significant effects on the calcium channels of the heart, making it ineffective for treating dysrhythmias like atrial fibrillation. Nifedipine is commonly used in conditions such as angina pectoris, essential hypertension, and vasospastic angina due to its vasodilatory effects and anti-anginal properties. Question 25. The renin-angiotensin-aldosterone system plays an important role in maintaining blood pressure. Which compound in this system is most powerful at raising blood pressure? Angiotensin I, angiotensin II, angiotensin III, renin. B. Angiotensin II. Correct answer. Angiotensin II is the most potent compound in the renin-angiotensin-aldosterone system for raising blood pressure. It acts as a powerful vasoconstrictor, leading to increased systemic vascular resistance. Angiotensin II is formed from angiotensin I through the action of the angiotensin-converting enzyme. While renin initiates the cascade by converting angiotensinogen to angiotensin I, it is angiotensin II that exerts the strongest pressor effect.